I would like to ask you, what are the job roles that are available for fresh physiotherapy graduates, just finished physiotherapy?
They have various roles to play. They can start their own clinic, junior physiotherapist in the hospitals.
How would the career be progressing for her or him over the years?
It is a very promising pathway, chances to grow in their professional career, as well as if we take in the government sector where you join an institute as a junior physiotherapist, there is a lot of scope for the physiotherapist and it is very promising.
A very good evening to all out there. We are very happy and pleased to have this one more post on Me Story. And today we are very pleased to have Dr. Jarapla Srinivas Nayak sir here with us. Sir is a physiotherapist at NIMHANS, Bangalore. He's a highly accomplished physiotherapist who's had over 12 years of clinical, academic, and research experience. Sir also currently serves at the prestigious NIMHANS, Bangalore, where he is dedicated to delivering comprehensive physiotherapy care to all diverse patient care. He's a recipient of World Heart Day Award 2021 by the World Heart Federation. He has been awarded as a Young Achiever Award for the year 2022. He has received the Bursary Award for the World Physiotherapy Congress 2023 by World Physiotherapy. He's published papers in several national and international journals. We are so happy to have you, sir, here.
Thank you very much for that lovely introduction, and I'm indeed I thank the organization for giving me these opportunities to share about physiotherapy to the younger generation who are willing to take up their career in physiotherapy. And thank you very much for welcoming me. Thank you.
Yeah, I believe we have a wonderful crowd out here who has registered, and I'm sure everyone wants to know more about physiotherapy, maybe the clinical part of it or the academic part. So let's move on, and can we start, sir?
Yes, please.
Yeah. So I would like to ask you, what are the job roles that are available for fresh physiotherapy graduates, those who have just finished physiotherapy? What would you suggest for them?
So whenever we come across, as soon as they have completed the bachelor's of degree, which is called as bachelor's of physiotherapy, which is about 4 to 4.5 years, including 6 months of internship, they have various roles to play and job roles which are there in the market. So first they can start their own clinic, or they can start as a junior physiotherapist in the hospitals, and where they have a very crucial role to play in order to improve the function of the patients who are in the hospital sector, as well as they can do their further education in the form of masters in physiotherapy. And there are various roles like in the fitness sector, in the wellness sector. It's a gamut of options which are available for them to pursue for the fresh physiotherapy graduates.
Yeah, so that is how a fresh physiotherapy graduate can start off. Now, how would such a physiotherapist who is finished her physiotherapy in bachelor's, how would the career be progressing for her or him over the years?
So if we see the career and the career pathway of any physiotherapist, it is a very promising pathway, and which has got lot of chances to grow in their professional career, as well as the growth is very much depending upon the person who is yet to take it further in his career. So first, there are different categories where if we take in the government sector, where you join an institute as a junior physiotherapist, and after that you have a career progression as a senior physiotherapist, as a superintendent physiotherapist, as a chief physiotherapist. So this depends upon the number of experience you have put up in your service, as well as the qualifications what you acquire during the course of your professional career, and as well as the experience matters. So the more the experience and the more the specialization and the more the skill set, definitely the career looks very much promising for the youngsters. And there is a lot of scope for the physiotherapist, and it is very promising.
Yeah, that's nice to hear that the physiotherapist career grows really well. Now, if I have to ask, you were saying for the first question that you can start your own clinic. So, is that possible after graduation? What are the requirements for starting one's own clinic?
So, to after the bachelor's, an individual who is a new graduates who have undergone their bachelor's in physiotherapy, they can start their career as a private practitioner by opening their clinic or joining some hospital. If they would have to open their own clinic, there are certain statutory rules which are framed by the state or the district authorities, which they have to fulfill, that they have to have a registration done and their enrollment in their council. Now allied health council has come, they have to enroll in there, or if it's going to take time, there is a statutory bodies which are in place which they have to get enrolled into that, and then they can start their own clinical practice with all the guidelines, like having the equipments as well as the certifications which are required from the government agencies, and they are ready to go and practice. Yeah. And it is very much not a kind of a hard thing to start a clinic. It is very much easier, and I feel that apart from searching for the opportunities, it is good you get into this entrepreneurship and then start your own clinic and be a boss of your own self and lead a successful life.
Yeah, so as a physiotherapist, you can actually be an entrepreneur at a very young age. So, how can physiotherapists grow into leadership roles? Now, if they are in a hospital or in any healthcare organization, how do you think a physiotherapist can do any kind of leadership or any managerial role? Is there any possibility for a physiotherapist?
Yes. So, if you see any private hospital or any kind of academic setup or any clinical setting for that matter, usually the leadership skill comes with the practice and as well as the experience, because the more you are into the clinical services, you will know that what are the challenges, how to overcome through the experiences, and then that makes you a person who is capable enough to handle the present day-to-day challenges in the clinical setting, and separate specialization in managing the healthcare settings, and doing some kind of a continuous CPD courses where they can upskill their managerial skills, and that would be very much helpful them to skill into the leadership roles and get into managerial roles, and that will be motivating for them to grow ahead in their life.
Great. So if we have some, we've been speaking about the healthcare opportunities. That was all about the private sector. Now coming to a government job opportunity, many of them would be wanting to look at a government sector. So are there enough government opportunities available for the physiotherapists?
Yeah, when we talk about government hospitals, usually the hospitals as such they are less in number. So, but if you see the central government aims, the All India Institute of Medical Sciences have been established in each and every state, as well as their number is increasing constantly. So the opportunities, recently there was one notification which has come, which is called as common recruitment exam, where around some hundreds of physiotherapy vacancies were they present across the AIMS campuses, and in government sector usually there needs to be a reform which has to be done, because earlier for physiotherapists the recruitment was around some diploma courses were the eligibility criteria, but now it has been taken out, and now bachelor's plus who is possessing 2 years of experience can get into the physiotherapy career in a hospital setup, and their growth is very much stable there, and we carry a sense of pride because we are working in a private hospital, in a government hospital, whereas poor people who cannot go to the private settings, they reach out for the government hospitals, where you feel that you are contributing it to the nation, and that gives a lot of personal satisfaction to you. And government job, there are a little bit pros and cons of the government job also, because in order to do something in the government job, we have to undergo lot of policy making in which, so but when you, that is a positive side, where in the private practice the things can move at a faster rate. So I would say that it would be on the personal choice of one physiotherapist to get into the government sector or a private sector.
Yeah, that comes from a passionate government employee, Dr. Srinivas. So, my next question would be, what is the scope of physiotherapy in industries like we have these corporate wellness programs, we have rehabilitation centers. So, unlike hospitals, what is the scope of physiotherapy in these kind of industries?
Yeah, physiotherapy scope of practice is very diverse actually, and whenever we think of physiotherapy practice, we think about only hospitals and the government jobs and some kind of home care, or these are the common things which comes into our mind. But if you see the aging population in our country, so the mean average age of our India is around some 30 to 35 years. And after 10-15 years, we would see that everybody would be in the age group of 50 to 60 years of age, where we are going to have higher number of people who are in the geriatric age group, and the number of we are becoming a diabetic capital, and the non-communicable diseases are also increasing in number. So I feel that the physiotherapy scope is very diverse and it's very promising, not only in India but abroad. So when we talk about the perception of health now in the 2025, each and every individual is very much concerned about their health. They want to be very much healthy. They don't want to get into kind of some disease and then approach a healthcare hospital. But nowadays the preventive health is into the market, and lots of fitness centers are there, where as a physiotherapist you can help the patient to be fit, active, and get rid of these lifestyle modifications, where lifestyle diseases, where they are very much prone to back pain, neck pain, as well as many other problems like obesity. So I think physiotherapists in this context, physiotherapists will have a lot of immense potential for to help them and get a good name for yourself as well as for the profession too.
Yeah, that's, I think even our students could relate to it because they would also be in some of these wellness programs, and I'm sure they could see that the growth of physiotherapy can be even in these sectors. Can physiotherapists work in military or any defense sector? And if so, how should our students prepare for it?
Yeah, so in the defense and military, usually there are lots of vacancies like AFMC, they have their own hospitals, as well as defense, they have their own hospitals for the staff who are working in the defense and navy, and as well as military. So they have their own kind of hospitals and recruitment processes, and the vacancies for this military, defense, as well as the navy are going to be done by an agency which is called a staff selection committee. So they are going to advertise it, and then you need to be little bit, they are going to have certain standards you need to meet to that. But as an educational qualification per se, BPT, bachelor's of physiotherapy plus 2 years of experience would be enough to land as a physiotherapist there. And as you progress in the career, you need to upgrade yourself and then progress in the sector. And working with military, navy itself is a matter of pride,
Right.
because they are taking care of our nation, and as a physiotherapist you also get an opportunity to take care of them. So it is one of the good opportunity for the physiotherapists. But the number of opportunities which are available are little less, but still we have a chance that we can get into these services too as a physiotherapist.
So, if not directly into the military, you can be a physiotherapist and try to get into the military or the defense sector for that matter. How can networking with healthcare professionals like both of us are physiotherapists? So, how can this kind of networking help in a career growth for a physiotherapist?
Yeah, networking plays a very important role in this present generation. If you see, whenever we are into a profession, we should have a team of professionals who are working, and a collaboration between the professionals is very much important in order to grow further. And when you have a network of professionals, you can collaborate and work together, and as well as share your ideas, mutual exchange of ideas. And whenever you have a patient where he's from other location and he reaches out to you, when you have a network of people who are you are in touch with, you can refer them so that he is taken care there, and where you are providing the patient care wherever you are, but not by your presence, by your network. And these things play a very important role. And whenever you are in some network, you are kind of the way you grow also also increases. And then networking is the future, I would say that.
That's nice to hear. So if you have your group of friends who are already physiotherapists in different parts, you can definitely refer once you become one, so that the patient doesn't have to travel from, one place to another also just to take the therapy. What are the career options beyond the clinical practice? Like if you have a healthcare consultancy or a startup, can a physiotherapist have any option in such areas?
Now we see that India and especially we are in Bangalore. So we are seeing the Bangalore is a startup capital of India, where nowadays the startup culture is very much improving, and we are integrating physiotherapy with technology, with AI, and with motion analysis, and getting our work done with the kind of technological innovations, and leveraging this virtual reality or the technology has made the physiotherapy profession as one of the uh, kind of a startup capital. As well as the technology has been making the therapy which is outcome measured, where we can measure those in live and in a fraction of second, and where we are taking the help of technology, we are making it very much easier for the patient, and where they don't get bored by the traditional exercises and in the form of gamification of the exercises. And technology is taking the wave now, and the startups are also increasing in number in order to make the wearable technology, as well as we have the CGM patches in the diabetes management, and we have the ROM analysis, the gait analysis, and the balance deviations in order to see that dynamic posturography. So there are a lot of bunch of and the gamut of technologies which are available, and there is a lot of potential. And where a physiotherapist not only work in a hospital, but you are interested in developing some kind of a technology for this specific patient group, you have a role to play. You can be a technology consultant to the engineers, where they get the engineering expertise, and you get the medicine expertise. And when you both collaborate and work together, then that comes a new innovation. So physiotherapists have a great role to play in the tech innovation, and you can be a consultant and advisor to these engineering startups and kind of companies, where you have a nice promising career in that too. And this has been going in a upsurge after the COVID.
So basically, a technology and healthcare together is the in thing and the trend now. So physiotherapists can look for such opportunities. How would you think is the demand for physiotherapists expected to grow like in the next 5 to 10 years? Because if our students start up their career now, like if they are starting into first BPT, first year of bachelor's of physiotherapy, 5 years down the line, 10 years down the line, what do you think are their wave of growth?
Yeah, see, just now I have told you earlier also. See, the mean age is around some 30 to 35 years, but in the coming 5 to 10 years, we are going to see a lot of elderly patients who are diabetic, who are having some cardiovascular issues and musculoskeletal problems like neck pain, back pain, and as well as many other issues. So I feel that the demand for physiotherapy is increasing not only in India but abroad. So I feel that the career is very promising. And according to some sources like Physiotherapy India, they say that 1.5 lakh physiotherapists are required in order to cater to the present population, and the population is increasing, the demand for the physiotherapist also will increase. And this importance of physiotherapy is not only in urban areas but in also rural areas also. We have a lot of scope for physiotherapists.
Could you just elaborate on this aging population and what exactly are these physiotherapy services that could be required for this aging population?
Yeah, if you see in the geriatric patients, the normal degenerative disorders like musculoskeletal problems like neck pain, back pain, as well as these contribute to the majority of the problems. And people who have undergone some kind of joint replacements where physiotherapy is an integral part to get back to them, as well as in the trauma and in fracture management. That's one of the things, because in elderly we have see a lot of falls prevention. We have a role to play in that, as well as the neurodegenerative disorders. If you see in geriatrics now, the in 2050 they say that dementia cases are going to increase by twice thrice. So as a physiotherapist and in catering, we have specialized courses, MPT in masters in physiotherapy in geriatrics, where you are going to learn the core competent skills in order to handle the geriatric patients. So I feel that these are all the programs which going to make you as a physiotherapist with core competent skills in order to handle the geriatric patients. So the future looks very promising for us, and who is willing to work and having that zeal to help the older individuals and wanted to work in the healthcare sector, I think that this is a growing area and upcoming area where they can explore.
So, physiotherapy basically in community health is what Sir was elaborating on. Could you also elaborate on this preventive healthcare and wellness? How can a physiotherapist help?
There are a lot of rehabilitation centers, fitness centers coming up, so they can give their expertise. See, we are very enthusiastic, and we land up every. If you see the number of membership in a gym on the in the month of January would be skyrocketing, and by the month of March and April they will come back to the normalcy. Why is that happening? Because we are like, we take that resolution to better be in a better health, but that is not happening. And we also face that we need a structured program in order to make you a healthier person. You need a person who is sound in his knowledge, in his exercise, how to what exercises need to be done, and then what frequency you need, whether you need strengthening or whether you need endurance or whether you need weight loss. A physiotherapist is a person who can ally, who can work in collaboration with a strength and conditioning coaches. And these two people along with physiotherapists can help the patient to transform, or the people who are in the rehabilitation centers or in the fitness centers to transform into a better version of them, and avoiding complications because of this. Nowadays we can see that many of the youngsters are getting sudden death due to some kind of heart attack or myocardial infarction. This rate is going high because I think that they need a structured planning exercise regime which need to be given under the supervision of a physiotherapist or a professional, so that these things, untoward incidents which are happening, that can be prevented, and which they can be always, when they have any doubt, they can get back to the professional and go in a scientific way in order to be healthier, not to become that now I am 100 kgs in within 10 days I have to lose. Nothing works here like that. It has to be scientific and it has to be scientifically done, and it has to be done in a graded manner, not like 2 minutes Maggie kind of thing.
So I'm sure the physiotherapy students who are here, or maybe the ones who are wanting to take up physiotherapy, once they take up the physiotherapy course, they would actually have that knowledge to even save a family member or a friend, because that is what preventive wellness is all about as well. Talking about, in between service, talking about technology. Let's elaborate on technologies like robotics, virtual therapy. virtual reality, virtual rehabilitation. How is it changing the way our physiotherapy profession is going? Because these are the new trends which are happening in our profession.
Yeah, so the robotics as well as the technological innovations, uh, we have been integrating it into our practice, and we have seen that patients, when if a patient got some paralysis of one side of the body which he cannot use, in order to make him stand and walk, we need at least 2 to 3 people. So, which robotics have decreased the manpower, and if you put him on a robotic, the robot is going to make him walk, whereas you are going to give him the settings like how many repetitions have to be done, in which angulation the knee, hip and ankle should move. So the entire control is done by a physiotherapist, where the entire management, in order to make him stand, everything is mechanized now, and the burden onto the physiotherapist has totally come down. And we have also seen that when we ask them to do manual exercises, the kind of response what we get is not very promising. They get tired very easily, and because they are not able to do some kind of exercises, they say that their participation also comes down over a period of time. But when we use virtual reality, immersive, non-immersive, their kind of involvement is very much higher, and their participation level improves, and the number of repetitions in neurology, in order to get back a movement, the repetition plays a very major role. So when we involve the patients into these technological innovations like VR, AI, the repetition increases, and the recovery also, recovery comes very much earlier when compared to the normal traditional process.
Yeah, so that is about robotics. Now the another trend which is happening is when Olympics starts, or when you have any Asian Games, or even for that matter our IPL. We have a lot of talk on physiotherapists being a prime member of the team. So there have been news when physiotherapists have helped the cricketer or the athlete for that matter to regain and get back into the game. So what is the sports physiotherapy, sir, and how can a student build a career working with such athletes or any sportsman for that matter?
Uh, so after your bachelor's in physiotherapy, you have a wide range of specialized courses. You have in orthopedics, where you are going to see about fractures, joint replacements, shoulder repairs, arthroscopy surgeries, and many infective disorders. And you have sports physiotherapy in specific sports. When you learn about sports, you are going to learn about cricket, you are going to learn about badminton, you are going to learn about a wide range of sports. And when you are also going to learn about neurology, you are going to learn about geriatrics, a wide range of specialization, as well as girls can take up into women's health, where this antenatal, postnatal also, which is coming up in order to improve the health of a woman, as well as child care in pediatrics. So there is a wide range of specialization which are available. And when we talk about sports, a sports physiotherapist is an integral part of the team, which who help the patients to perform better. So on the field, if we see majority, whenever we talk about sports physiotherapy, the one thing which comes to our mind is cricket. So you can see in majority of the conditions, when players are playing and the batsman or the bowler gets hurt, the first person who is called on the field is a physiotherapist. So the physiotherapist is a person who comes in at the first sight with the player, and he is continuously working with the player. And if he has any problem in performing or optimizing his performance, and the player and the physiotherapist, they both sit together and talk together and decide a program and give good result for the team. And now Olympics 2036, they are planning to do it in India. So I think, sir, the now it is 2025, we have a decade. So I think it's a good opportunity for all the youngsters who wants to be in physiotherapy and who are interested in this sports domain. This is the right time to take the plunge into it. And who knows, that you may be with the your favorite sports player in the 10 sports, and you may be watching along with your family, and you may be on the field with them.
Yeah. I'm sure they must be dreaming about it as well. Moving on, what are these roles of physiotherapists in international organizations like, say, a WHO, World Health Organization? What are the actual roles that a physiotherapist can play there?
Yeah, when we talk about international organizations like not only WHO but also various organizations, these are the organizations who are very much working about particular condition. We have like International Association for Parkinson and Movement Disorder. So this is an organization which works about the uh, Parkinson, as well as we have Stroke Association. We have international associations which are talking about different diseases, and in order to make the person healthier, on how to prevent it and what can be done once the patient has been suffering with the disease. As a physiotherapist, we can collaborate with the clinicians, with the doctors, and work in a patient centric way in a policy making, where the WHO comes in the form of a policy making, and where they come up with kind of a policy decision that these are the things which need to be done, where physiotherapists can be on their board and help to give their physiotherapist perspective in the policy making. As a physiotherapist, what needs to be done for this particular problem, or these particular guidelines need to be added from a physiotherapy perspective. And representation of the allied or different professionals in the international bodies gives them a good idea and good guidelines from a holistic approach also.
Okay. So that is about the international part of it. And if I have to talk about telehealth, we all went through a crisis in 2020, 2021, where things were online. And telehealth had started booming back then. And what do you think about these online rehabilitation therapy? What is your view about it, sir?
Yeah, tele-rehabilitation post the COVID, it has been the new normal. And where a person sitting in US can take a consultation in India, and this has been very simpler, and now we are hosting our session also online, where these kind of things gives us a lot of privilege, as well as sitting at one place and then trying to communicate to the doctor, and where our time to travel has come down, as well as we can get into touch with any person across the country, across the globe, through this tele-rehabilitation. And especially tele-rehabilitation helps the people who are like in the rural areas where they don't have access to the services. The tele-rehabilitation is a boom to them, and uh, tele-rehabilitation would be one of the future tool and one of the biggest revolutions in the healthcare sector.
Yeah, that's actually what we are doing as well now, trying to make you guys aware about what is physiotherapy through a online session. So, what is the scope of physiotherapy if I have to talk in the field of in the space, and or if is there any scope for working with astronauts for physiotherapists?
Yeah. So if you see in United States, NASA and these kind of agencies, definitely because when you're in a space, the microgravity environment where you have like uh, things where you that doesn't work the same way as they work on the ground. So ISRO, NASA, these are the agencies. It is in the starting stage, like how can they maintain their strength and strength in the space, as well as how to maintain their bone mass density, and how to minimize the effects of anti microgravity there. So it has been in a budding stage, and in Western countries it's been there since a long and always. Many universities are also many universities are also offering this specialization courses in the space physiotherapy, how you can help the astronauts in the space. So this is a very new area, and whereas this is an emerging field in the physiotherapy domain, where we have to do a lot of things, and definitely as a physiotherapist we have a role to play in the space domain.
Oh, that's good to hear that even you can work with astronauts for that matter then. So, sir, talking about space, we came back to Earth. Let's say about a disaster management or an emergency care. How good is the scope, or is there any scope for physiotherapists in that matter?
Yeah, so disaster management, because whenever there is any natural calamity or earthquake or anything, there are people who are been suffering with a fracture, or they have been displaced, and they have been getting some kind of a injury or a trauma. Definitely, as a physiotherapist, we have there in order to regain their mobility, improve their function, and improve their quality of life. In the disaster management, we have a role to play, and this is a field which needs more of kind of physiotherapy guidelines need to be done. There are not major programs which are available in the disaster management, but we have a role to play. And in some Western countries, in some universities, there are certain programs which are available for physiotherapists in disaster management. But in India, I am not sure about any program for physiotherapists in specialized in disaster management. But we have a role to play. And in NIMHANS, we have a center of psychosocial support in disaster management, where they frequently conduct some programs. And if any physiotherapist is interested in that area, definitely they can explore that.
Yeah. So there are some students who would like to know if there are any particular entrance exams to pursue bachelor's of physiotherapy, or is it that they can get in with their 12th standard marks itself?
Now there has been a earlier there were like some state entrance tests in order to get into the bachelor's of physiotherapy course, but now there is been one NEET, the entrance exam which you need to write in to get into the bachelor's of physiotherapy is NEET, and based on that your NEET rank you will be getting into the bachelor's of physiotherapy. But always, if you are not getting a good rank there, but still you have that strong desire, you can get into the management seat or other ways in order to get into the bachelor's of physiotherapy.
So yeah, we have got a nationalized thing where NEET may start up for physiotherapy courses, but so far it has not been the thing, but soon it may start up as well. The students here want to know what is the earning potential of a physiotherapist in India and abroad.
Yeah, see, everybody, this is the main thing they focus upon. See, earning is one of the thing which varies from individual to individual as well as from location to location. So, on an average, one bachelor of physiotherapy fresher graduate would earn around some 4 to 5 lakhs per annum, and it increases in the government sector. And as you specialize more, and as you do your masters in physiotherapy as well as you do your PhD, and the more experience you get, your earning potential will also increase.
Yeah. What about abroad, sir? Is there any higher potential for physiotherapists abroad?
Yeah, abroad also there is a lot of demand for physiotherapists in the UAE, Canada, UK, as well as United States. So there is a lot of demand, and abroad is also one of the area where you can explore after your bachelor's. You can move abroad and then start your career there, and it is also a wonderful opportunities available not only in India but globally.
Okay, so our students, now there are hundreds of professions here. Why should they choose physiotherapy as a career, especially when they want to know that when doctors and surgeons are dominating the healthcare field, where exactly does physiotherapy lie? What is the key role of a physiotherapist or a key benefit of choosing physiotherapy as a profession and not being a MBBS doctor or an MD surgeon?
So each and every field in an healthcare got its role to play, and as a physiotherapist, what benefit you are going to achieve is basically it is an high demand profession where they, according to the aging, there are a lot of problems which are happening to the people and which you have a role to play, as well as let's take an example of an individual who has got a kind of a paralysis of half of the body, who cannot stand, who cannot walk, who cannot get out of the bed, who cannot move in the bed also, and where you have a role to play. And when patient says that because of you, because of physiotherapy, it's a person, one individual in the healthcare who can make a patient, make him stand, a paralytic patient stand and walk, is a physiotherapist. So if you are very much interested in helping the patient regain that movement, function, and especially with these two and improving the quality of life, there is no other profession in the healthcare other than physiotherapy. And as a physiotherapist, you have a perfect work life balance, whereas you have a flexible work schedule. You can work in as a freelancer, you can learn, you can work as a part timer, and there are different work settings. You can work in a hospital, you can work in a academia, you can work in research, you can work in kind of a fitness centers. There are different centers. I don't think so. Is there any other profession which offers this diverse work setting, the personal work life balance, and then the personal gratitude and that social impact what we have? I think physiotherapist,
It's
all boxes tick.
yeah, it's one of the most satisfying professions when it comes to doctors or surgeons or whatever profession you choose. But when it comes to physiotherapy, that when the patient says, I'm all well because of you, it's definitely satisfying. So, is it a recession-proof career? What would you suggest on that? Has any time recession taken over physiotherapy, or physiotherapy has always, skipped the recession part and moved forward?
See, as long as I know, there is no recession proof. I think that each and every, as the India is a highly populous country, the population is increasing. I think that nearly for about 2 to 3 decades, I don't think so any recession would affect the physiotherapists and the rehabilitation and the preventive healthcare per se. So there is no recession, and I feel that each and every individual is a potential candidate for physiotherapy. Imagine a locality or a household without any musculoskeletal problem, without a neck pain, without a back pain, without a knee pain. So I think that each and every locality would require, or each and every home would require a physiotherapist to take care of their health. So I think that the future looks very promising for the physiotherapist, and this is a recession-free profession, I would say, to all the people who have joined.
Yeah. So our students would also like to know, sir, how can they choose research in masters, or basically choose a specialty after bachelor's? What should be their checklist to choose a particular master specialty?
So, in order to choose what kind of a specialization you would like to enter after your bachelor's, so after your bachelor's degree is totally of 4.5 years. So 4 years of your education and 6 months of your internship program. So I think the internship program, you are going to have exposure to all the different kinds of domains. That is where you have to find your interests and which field you are interested in, and that's where you have to make a choice. And always your teachers and your professors are always there to guide you. But I think that internship period is the period where you have to choose which career makes you that or interest lies, and then you have to take your career further. I think that internship period is the period where you are going to get answer for this.
Yeah, I think if you once you start your internship and you start meeting patients, that is when you will feel that I can do this better than that, and then you can choose your specialty at that point of time. That makes another question, sir, where they're asking you, how has a patient's progress has ever a patient's progress truly inspired you as a physiotherapist?
Yeah, so I met one youngster in my journey. Still, I remember him. He was around 22 years old, met with a road traffic accident, and he had a spinal cord injury. And he was totally bedbound, depressed, was like bubbling with energy and joy. One day, suddenly, a fraction of a second changed his life career. And when I met him for the first time, he was very much devastated, depressed about, I cannot move my leg, I cannot get up, I cannot, my parents are doing everything for me. So he was very much devastated, and through a physiotherapy journey of 6 to 9 months of journey, I could see him lots of progress in him, and now he is back to his working. He's back to his day routine, and he's working what he used to do earlier in a software company, and he's being, and whenever any festival comes, I see a text for him, and sir, thank you for what you have done to me. And those words, I think, uh, are more than your paycheck or your balance in your account actually. So I feel that that is very much personal satisfaction what we get, that people when they recognize the work you put in their health, and you have achieved a lot in their life, and which made a lot of personal impact in their life, and they acknowledge that, and they come, and when they say that because of you, whatever I am today, I'm able to walk, or I'm going to do this, it's because of you. That satisfaction is like, I cannot put it in words actually. To feel this, or in order to experience this, I request you, all of you, to take physiotherapy.
Yeah, so that passionate is sir about his profession, and I'm sure everyone will be doubly and triply satisfied when we get such patient stories, to listen to. There was this question, sir, from our students here. How is technology changing physiotherapy, which you have already briefed about? But they also want to know, can robots replace physiotherapists?
Yeah, when I told about technology, it's like you can use it as a leverage. You can take the leverage of technology, but then they are not going to replace the individuals actually. So I feel that now chat GPT is there. It has simplified our process, but that simplification can be done, but totally taking off the manpower, I don't think so. In order to chat GPT to work, or the technology to work, you have to give a command, then only it works. So I think that still there is going to be a human control over technology, and we are going to simplify our working processes, and then take a leverage, and take the maximum benefit out of it. And I don't think so that they are going to take away the human touch in the healthcare.
Humans finally need humans to do the physiotherapy. We don't need technology full driven for this role. So, are there any internship opportunities during the course? Our students would like to know. Sir had mentioned 6 months. How do they? How is this practical in their coursework? Is what our students here want to know.
Yeah. So actually, that is a very well a structured curriculum in which you have 4 years of courses, and you have specific anatomy subjects, as well as the domain specific orthopedics, neurology, and then physiotherapy related subjects. So I think that when you attach into an institution which is with the medical college, so the more learning theoretical and not applying on the patients will not help you to gather a lot of knowledge and that confidence when you are handling patients. So I request all the physiotherapists to please get into an admission where they have good clinical setup, where they have a good hospital where you can learn on the patients, where you can use your clinical skill set on the patients, and do things. That would be one of the important factor to turn out into a good physiotherapist, and take away all the inhibitions in treating the patients. And there are several institutions like NIMHANS provide a lot of courses, training programs, where but that's after your internship, or in your internship after the finishing of your 4 years. And there are some kind of webinars which will be happening, where you can attend those and learn the new techniques which are happening in the healthcare sector, and different conferences where you can attend, where you can see what are the latest trends in the physiotherapy profession, what is going to be the future technology, and how you can be ahead of this technology in order to be at the forefront.
Yeah. So coming down to the last few questions now, we have our students who want to know, can physiotherapy help in mental stress, anxiety? Can they improve sleep? Is what our students
Yeah,
would
yeah.
like to know.
Yeah, definitely. There is definitely we have a role to play in the mental health disorders nowadays. You can see the mental health problems like anxiety, depression, as well as insomnia, sleeplessness, and very bad sleep routine, binging over the Netflix or some kind of a technology addiction, not following a proper routine. So these are all the factors which are leading to the mental illness. And mental illness, when you talk about a mental illness, it is a multifactorial. And as a physiotherapist, by specialized interventions like breathing exercises, relaxation exercises, cognitive behavioral therapy, as well as behavioral modifications, we can take care of the mental health issues.
Yeah. So, talking about our personal growth, empathy, and communication skills, is it a requirement when it comes to physiotherapy, or do you think these skills need to be present?
Yeah. These are the communication skills are the vital thing, because on day-to-day basis you will be encountering with different language patients. So if you are interested, please learn majority of the languages, because if you are in a healthcare field, you have to talk with patients with different languages. You have to be multilinguistic. You have to be empathetic, and you have to communicate with the patients, know their complaints, and if you are not communicating in a proper way, then you cannot get into their heart and you cannot understand their problems, and the whatever the treatment you are providing may not be highly effective and you may not get the desired results. So I think that mastering your communication skills as well as your soft skills, as well as being a multilinguistic person and leaving those inhibitions and being bold enough to ask. So if you are good at this, I think you are 30 to 40% you are ready for physiotherapy.
That's great, sir. So there's been I had questions related to space, astronauts, sports. So basically now there is a question where physiotherapists want to know whether they can work with the film actors, that is stunt actors, and whether their recovery and all is also progressed or helped by the physiotherapist.
Yeah. So if you see recently, Pushpa 1, Pushpa 2 is recent one, and the previous one, where Allu Arjun had one a kind of a mannerism of your lifting the shoulder up. So he has to maintain that posture for about months together, and over a period of time, he had developed a neck posture. You can just type in the Google, you will get the answer how physiotherapists have helped him to get over that pain. So definitely, you can, and I know some of the physios who treat film stars, and they also get back pain, neck pain due to doing some kind of a stunt activity or some acrobats. So definitely we have a role to play, not only in films but also in politicians and all the whole professional arena. Wherever humans are involved, physiotherapists are there.
Physiotherapists are there, yes. So it is not that film actors are born in another planet altogether. They're not definitely aliens. As long as they're humans, they need therapy as well. Sir, our students have brought up a question saying, can we do training in NIMHANS? Is there any eligibility for it or any fees?
Yeah, so training in NIMHANS is available, and it is you have to be the eligibility for that is you have to complete your 4 years of your training. But for observing, you can come at any point of time, but you will not be allowed to see patients or touch patients. But I think if you have completed your 4 years of your bachelor's of physiotherapy and you are coming for an internship, I think that would be the right time to come in, so that you have a good knowledge about the entire conditions, entire thing what needs to be done, and we are there to guide you there. So I think that if you are just wanted to explore what is happening, how it is happening, you can drop at any point of time. But in order to do try out and in order to see patients, I think after 4 years internship period would be the ideal time. And yeah, we have a training fee for that. For government institutions, I think For 1 month, it is 2,500, and for private institutions, I think it's around 3 to 5,000. I'm not sure. You can just check it out in the website. Yeah.
So I think that was the end of our questions from our students. That is the end of our session. So what is this one takeaway that you would, from today's session, what is that one takeaway or the one point that our students or our audience would want to listen to and take away, and so that they choose physiotherapy and or grow up to be better physiotherapy graduates or pursue a wonderful career in physiotherapy? What is that one takeaway that you want to give?
See, if you are very much interested in being the healthcare field and in order to help out the patients who are suffering and in order to make a difference in their lives, I think physiotherapy, and in order to unlock your career in healthcare sector, physiotherapy is one of the promising and ever evolving and dynamic field, and which is been in demand not only in India but globally. So I think that any person who is in this session, or your friends or parents who are here, I think physiotherapy is one of the profession which is having a bright future for the youngsters. And I think that which this profession gives you the kind of a respect in the society, as well as the personal satisfaction, the work-life balance, and you need to get into work with your favorite sports star, film star, favorite politician, as well as your favorite, for the girls, the celebrities you want to work with. You have a great career in physiotherapy. So I think that physiotherapy is ready to embrace you. Are you ready? Is the question.
Yeah, I'm sure after this long 1 hour session that our students have a wide array of opportunities. And we definitely thank you, Dr. Srinivas Nayak, to come over here. And we're grateful to Acharya as well for giving you this opportunity to, answer our questions and answer our students' queries. I'm sure physiotherapy is ready for them. Are you guys ready to come into our family of being a physiotherapist?